Hey, it's week 3. How's everybody doing? Good morning, Tyler. I like that hat.
This is my good luck hat.
I need to get I don't have a lot of Sixers hat. I bought one and it doesn't fit right. It's got too much stuff. So when I put it on, you can feel the embroidery on your head. I hate that.
These are my I know they're not aesthetically the best hats, but they're my favorite kind of hats. I don't like the hats with it feels like it's I'm wearing a helmet.
It's good. I'm gonna wear my cowboy hat later.
The cowboy hat?
Yeah, I'm getting bored, man. This is week 3, and speaking of people who are also, well, she's probably not bored, but who aren't working, Kristin's here. Yay! Hello, welcome.
Hi.
So Kristin's a nurse, but she's gonna kind of tell us what the last 2 weeks have been like kind of specifically what nursing you've done. I don't know, all that sort of stuff. I don't at least have really any knowledge or firsthand knowledge of any of that. So hearing from you would be great. So Kristin, do you mind kind of telling us a little bit about yourself and what you do and then what has happened maybe in the last 3 weeks or so?
Okay. So I do IVF and fertility nursing right now. So we're taking care of patients who need to have those procedures done and just looking to start a family, that kind of thing.
Now's the
time,
right? It's a little bit.
Yeah. So and that's the problem. We've had a lot of patients right now who are upset. They're, they're looking at it we should be able to start a family. The understanding of this virus is really not out there enough at this.
I think too, and I don't want to speak for anybody, but I think too with fertility, timing is important as well, right? So yes. I can see how they would be frustrated.
Yes.
And that's okay. But yeah, it does.
But also even I would have to but even selfishly, I would be if it was me in that position, I would be no, let's probably not do this now. I don't want to be heading to a hospital or a clinic regularly right now.
Well, that's tough. Tyler, I know I have friends who have wanted to conceive and then couldn't. Mm-hmm. And then they went, that route, and that's what worked for them. So I can understand.
I get it.
Yeah. I understand. So how have Kristin then? Assuming you're not working out, what has happened in the last 2 weeks?
So within the last 2 weeks, every day was kind of an hour by hour change in the office. So it was pretty much it started off small, wasn't as concerned, and by the end we were screening people before they come in, checking temperatures, asking pertinent questions, if they've traveled even to New Jersey, as far as where they've been. If they were in those areas, we weren't really allowing people to come in. So it got really stringent right at
and
the
was
end.
Was that 2 weeks, or was that a week ago, or?
Ago, but yeah, and we closed
early.
My office on Tuesday closed.
Uh-huh. Okay. So, that was a week ago doing those sort of things. Now we're in week 3 now. It's getting to the point, I'm not going to go into details, but I've talked to a friend this morning who knows someone who has it and is, hasn't been tested, probably can't get a test, all that sort of stuff. So the only thing you can do is stay home.
Right.
How do you feel?
Sucks.
How are your...
me or Kristin? I think Kristin.
Yeah,
Kristin,
I know how you feel, George. You feeling all right?
Kristin, are you... Oh, yeah.
What?
Were you talking to Measler? He always stays up till 4 a.m. I'm dude, I go to bed at 9. So what are your plans then? Obviously you're not working now. You're kind of... before we came on, you talked about the possibility, you've worked as a nurse on a floor before,
yes,
and the possibility of that might happen again. Can you talk a little bit about what you did previously as on the floor, and then what you're hearing about possibly maybe needing to go in or something like that?
So I'm seeing now, friends, as of right now, hospitals are cutting staff, but as things get worse and people start to have issues, I feel they're going to eventually be calling in people to come in. So we're kind of waiting to see where that's at. I've never been furloughed before, so I don't know what to expect of this exactly, like, and where to go or even where to start things. But at this point,
when you get furloughed, I mean,
it means
that just means like what does that mean? Like you're going to be able to come back to your job, you just don't get paid?
Yeah, no pay right now.
Right.
Yeah.
Can you talk a little bit to people about personal protective gear and how important it is to if you have some to donate, or like what are some of the nurses going through, that have limited supply, or the hospitals have limited supply?
So at this point, yeah, I mean, that is the most important thing that they need, are masks. And every year the hospitals were doing fit testing on us to make sure that these N95 masks fit properly, so that you're not exposed to these type of things. And now I guess they just weren't ready for what was coming, but they are very important. I mean, this is a respiratory situation, so they are very important. So I did see that there was a number of places in the Lehigh Valley even doing like the masks and all of that. Any type of like equipment that they could get at this point is really important for them. Mm-hmm. Mm-hmm.
Oh man, it's just being in week 3 now. Like I think last week I was a little more anxious than starting week 3, because you're kind of like, now this is what it is. This is a new normal.
That's how I feel.
It's not good.
Now, like, especially with the news, it's like at least till April 30th, this is what we'll be doing.
April 30th.
Listen, here's the thing. Like,
no, I'm not even worried about me. I can sit here all day, but I know friends who own restaurants.
Mm-hmm.
How does that even work?
Yeah, I mean, I don't know.
It's this week is just, I think it's going to be more stressful than anything, because I don't know. What was that?
I don't know, like probably something banging around.
I'm trying to find like any fun in my life. So, Kristin, what have you been doing to like keep yourself occupied? Let's not talk about nursing.
So I have a 7-year-old. They just started.
Well, there you go.
Online classes.
Oh man.
Today. So
are they doing that right now?
Yes.
Tyler could probably help out with their homework.
That's about my reading level.
So I've become a teacher now on the side. So
how has it been? I mean, I know for me, a 7-year-old is different. I have a 4-year-old. So it has been fun, but she has asked me, probably between me and my wife, like 1.5 billion questions in the last 3 days. How's it been, being a mom at home? I mean, stressful, I'm sure, a little bit, but
finding things to do. I'm sure like it's just the entertainment value of everything at this point is.
Can you imagine if this happened like in 1989? Like, what would we do at home? You would have like ruined all your VHS tapes by now.
Is 7 years old? She's aware of what's going on, right?
Yeah, she is. Yeah.
So is there like, do you have to calm her down? Does she understand the severity of it?
She's worried about other people at this point. She can see that. So that's one of the things she's aware, because she can't go see like family and stuff like that. Like, we're not able to visit my parents, like things like that. So I know that like that's affected her. And in conversations I've had with other people, I'm like, just talk to your kids about like what's going on, make them aware of it. And that's the best you can do.
Yeah.
So.
All right. Well, we hope you all the best. Honestly, I hope you don't have to go in. I hope that everything just ends. But I think the reality now is, maybe that's not what's going to happen. So if you do have to go in, we wish you the best and be safe. And sucks. It's a weird morning. I don't know.
Yeah. Feels strange too.
Well, it's just like, I think it'll be better once the sun comes out. But yeah, just like waking up this morning.
Where's the sun? They said the sun was coming out, and I had to plan. I was going to walk today along like 5 miles.
I might go for a
podcast
walk.
on.
Throw on our podcast.
That would make me more anxious.
You know what's really funny? So I put up that podcast last night, and it has like 3 interviews. Kristin, maybe we'll put yours on. And Ryan Dugan messaged me. He's like, "Hey, dude, at 6 minutes and 33 seconds, there's definitely a fart."
What?
So, do you think like one of us farted? Either me, you, or Billy. So I have to go back in there and look at it or listen to it. Somebody farted. That makes me.
I don't remember.
I don't either, but I'll have to put it up. Hey, Kristin, thank you.
Thank you.
Be safe.
Stay safe out there.
Have fun if you can. And we hope to talk to you soon.
Thanks, guys.
All right. Bye-bye.
Bye.